Hello, ladies and gentlemen, welcome to my site. Welcome to Brain Boosters. In this short presentation, I'll be discussing medical management of a patient with mania. I'll take you through step by step on the most important information that you need to discuss during your examinations, during your exams. If you are a new member to my site, please subscribe and click on the notification bell so that you can always be notified when I upload a new video. That's the only way you can support me at the moment. So let's go straight into the discussion. The layout of medical management is as shown on this slide. So you begin with your aims, you take history, you do mental state examination, investigations. These are laboratory investigations also. Then you need to talk about drug therapy. Diagnosis, you may leave it out during your exams, but on the ground you need to give a diagnosis when you are you perform all these. You have to make a conclusion of what you have discovered after carrying out all these investigations as a diagnosis. But during exams you may leave this point out. Okay, that's the point of diagnosis. You can leave it out, it's not necessary. So from investigations you can go to drug therapy. Under drug therapy you need to mention the drug name, the dosage and route, mechanism of action, the side effects and nursing implications. So for drugs you can write a minimum of 2 and a maximum of 3 drugs unless specified. Okay, so aims. For aims, you should not have difficulties when coming up with aims. Just look at what you'll be doing under medical management, then create aims from that. Okay, so we are going to be taking history, mental state examination, we will do some investigations and administer medication. Why are we doing all these things? Then when you find out why, those are going to be your aims. Okay, so first of all, some of the aims you can write under this one are to prevent complications from arising. So as we administer drugs, we are going to prevent complications from arising. Okay, also to establish a diagnosis through screening and history taking. So when we take history, we do some investigations, we will establish a proper diagnosis of the client, what condition the client is suffering from. Also to stabilize the patient through appropriate medications. Okay, so we already talked about to prevent complications, but also we want to stabilize the patient so that the signs and symptoms of mania are reduced. So we want to stabilize the patient through appropriate medications. Okay, so that can also be one of your aims. From the aims we go to history taking. So under history taking or history taking, there are a lot of histories that you need to talk about here, a lot of histories that you need to mention, but it may not be necessary to talk about all the histories that you will have to take about the patient. Okay, so the most important histories that you can talk about to save time, history of the presenting illness, right? So take history of the presenting illness. Now we don't want you to tell us the process of how you'll be taking this history. Just mention what will be the outcome of the history taking. So you can say history of present illness will review how severe the condition is and how the patient is responding and coping up with the effects. Okay, yes, how the patient is coping with the symptoms of a condition. So history of the present illness or presenting complaint will review the severity of the condition and the onset of the condition and how severe it is, and how the client or patient is responding and coping up with the signs and symptoms of the condition. That is history of the presenting complaint. You can also talk about family history at this point. Family history will review the status of the family on mental illness and whether the patient's condition is as a result of genetics or inheritance. The client may have inherited the condition from one of his family members, okay, because mental illness, as we know, can be genetic conditions, can be genetic conditions. They can run through families. So also on family history, don't start talking about how you will take this history from the patient. It may not be necessary. There are other histories that you can talk about, such as past psychiatric history, medical history of the client, social history. I think social history is also important. Social history, you will talk about you have to assess for the patient's occupational status and source of income to find out how he fends for himself. Also, you need to record his level of education, relationship histories, marriage, sex orientation, number of children and individuals that currently live with the patient. Also, you need to also find out how the client spends his free time. Okay, how is the social life of the client? In our country, Zambia, people spend their social life mostly taking alcohol, abusing alcohol. Okay, so assess for the current alcohol or illicit drug usage from the client. So in your statement during exams, you may not have to mention all these things I've talked about here. You may just say social history will review what social activities the patient is involved in and whether they have any effect on the patient's mental health status. That would be enough. Okay, so from history taking, you can go to mental state exam. Mental state exam, you need to take note of the following. You are not taking history. When you're taking mental state examination, you are not taking history of the client. Okay, you are assessing the current client's orientation. Okay, at the moment of your interview, how oriented is your client? That's what you are looking at. Okay, so the mental state exam is an assessment of the patient that patient at the present time. Historical information should not be included in the section. Okay, so at this point, no historical information should be included. The patient should be assessed focusing on the affect, the mood of the client, thought process, thought content, insight, and his judgment. That's what you need to focus on, not history. Okay, so what you can say under mental state examination during your exam is that mental state examination will review the patient's orientation to the immediate events or to the immediate environment. His client's orientation to the immediate environment or the current situation. Okay, that's on mental state examination. So mental state examination will review the client's degree or extent of orientation or disorientation, okay, to the immediate events. From mental state examination, you need to go to investigations. We can talk about investigations now. Under investigations, we can carry out all types of investigations that we have to take. Remember, this client is going to be on very strong medications, and before giving those drugs, you need to carry out um, uh, investigations to establish baseline data, to establish baseline information, so that in case you observe any changes after the client is put on those medications, you will know that those changes are due to the medication that the client is taking. Okay, so order for tests such as urine tests, blood tests. You can also do liver function tests in this client. Also do head scans to rule out any other conditions that may produce signs of mania, and also to rule out head injuries, of course. Okay, so you can do those investigations. There are a lot more investigations that we are going to look at. Actually, I have them in this same presentation. You will see them. Skip the diagnosis, go to drug therapy. Okay, drug therapy, we have drugs that we are going to look at as well. Okay, so let's go to the next slides and see what we have there. So under investigations, these are some of the investigations that we can do: FBC, full blood count, U1Es, LFT, KFTs, the RPR, HIV, TSH, hepatitis B and C, vitamin B12 levels, pregnancy test, MRI, CT scans, DOA6, EEG and ECG tests, investigations. So these are important investigations that you need to carry out, especially in a patient with mania, because some of these investigations, because you'll be administering strong medications to the client that may produce damages to these body organs. So you want to establish baseline information. As I said earlier, you want to make sure that you detect any changes, because you will have the true information before you administer medication. And when you begin to administer these medications, you will see if the client is having any changes in those areas. Then you will know that these effects are due to the medications, and you will be required to change the type of medication or the dosages of the medications to help the client, okay, and prevent those adverse effects due to medication. On treatment, treatment is immediate and long-term, okay, for a patient with mania, and is aimed at reducing self-harm, harm to others, and destruction of property. If patient is violent, refer to general management of aggressive and violent patients. These are some of the drugs that we need to give the client with mania. You can give antipsychotics such as haloperidol, and anticonvulsants agent. We can give carbamazepine, which is Tegretol. Then we can also give the valprox sodium for anticonvulsants. Okay, actually the valprox sodium is one of the common medications that is usually given in Zambia. Okay, also sodium valprox as an anticonvulsant, it's also one of the common medication that is given for in patients suffering from mania. Selective serotonin reuptake inhibitor such as paroxetine, this one can also be administered to a patient with mania. A drug you should never leave out in your exams, as you are talking about in your exams: lithium carbonate or lithium citrate. Please talk about these medications. Though these drugs have terrible side effects, they can damage the patient's liver. So it's rarely given, it's rarely administered to patients with mania. Instead, most patients are put on sodium valproate and the valprox sodium. Most patients are put on these on these drugs instead of the lithium drugs. Okay, So these are some of the medications that we're going to talk about here. So we can give haloperidol about 2.5 milligrams to 5 milligrams per oral. This is under immediate treatment. Okay, this is if patient is being aggressive or violent, we need to give haloperidol to stabilize the client. Mechanism of action of haloperidol is that it blocks postsynaptic dopamine receptors in the brain. Okay, so dopamine receptors, it blocks them. Okay, these are postsynaptic dopamine receptors. That's the mechanism of action that you just have to write. This short statement. Side effects are dizziness and constipation. These are some of the side effects that the client may experience or may suffer from. Nursing implications: instruct the client or advise the client to get out of bed slowly because of the dizziness that they may have or experience. Then also advise the client to get more fiber into their diet because of the constipation that they are having, and also take patients' vital signs before and after medication. This is very important because of the effect on the cardiovascular system. We need to make sure that we take clients' vital signs before and after we give them this medication. Okay, the other drug you can give, if you do not give haloperidol, you can give them diazepam, about 5 to 10 milligrams per oral or IV. Okay, so this is if the client is aggressive or violent. This drug can be repeated in intervals of 6 hours till a maximum of 40 milligrams per day is achieved. The other medication that you can combine with haloperidol is sodium valproate. Sodium valproate, very common drug that is administered in our country, in Zambia, and about 500 milligrams OD per oral, and then you can increase to BD per oral. Mechanism of action is that it increases the amount of GABA in the brain. Side effects: dry mouth, black cherry stools, and feeling sleepy. These are just some of the side effects. There are some more side effects that I've not mentioned here. But in your exams, guys, just write 2 side effects and 2 nursing implications. Those are enough. Okay. Nursing implications, we have the following. You teach the client about drug side effects. Important. The client must know these drug side effects. If they see black cherry stools, they see blood in their urine and stool, they should know that these are the side effects of the drug that the nurse taught me about. Also, perform liver function tests before you administer the medication. You need to, and after administering, you need to continue doing these liver function tests to see how the liver is coping with sodium valproate. Okay, if you don't give sodium valproate, you can also give sodium divalprox, 500 milligrams once daily per oral, then increase to BD per oral as well. Or you can give carbamazepine as well, 200 milligrams BD, which is twice daily per oral, then can you increase to 400 milligrams per oral twice daily. Okay, so these are the medications, guys, that you can administer, that you can give to your patients who are suffering from mania. I hope this presentation is helpful to those students out there who are looking for the drug management of a patient with mania. Now let me emphasize some points here. Under medical management, guys, usually it's only about 15 marks which is allocated. So when you are talking about medications, write a minimum of 2 drugs and a maximum of 3 drugs. Okay, maximum 3 drugs. Okay, don't leave out sodium valproate if you don't talk about lithium. So you can talk about sodium or you talk about lithium, but don't talk about the two of them in under drug management. Okay, then also you talk about another medication. Okay, apart from sodium valproate, you can talk about haloperidol, or you talk about carbamazepine, or you talk about diazepam. You talk about these medications, then you'll be comfortable. Okay, you'll be comfortable. So don't talk about sodium valproate and sodium divalprox in one drug management. Okay, don't talk about them in one drug management, that you will administer both medications at once. That would be unnecessary. Okay, that would be misuse of medication. So you can talk about one drug, just one of these, then you talk about haloperidol. Okay, so pay attention on the on history taking, on the layout of the medical management, and always remember it as you are writing down your essay. Thank you guys for listening. If you are new to my channel, please remember to subscribe and share this presentation to others, and encourage others to subscribe to my channel. Thank you so much for watching. Bye bye.